Hello everyone, and boa tarde for the people in Brazil. That's the extent of my Portuguese, unfortunately. Um, but my name is Bobby Gheorghiu, and I am part of Canada Health Infoway. We're a federally funded nonprofit organization in Canada. And our main mission is the growth of digital health across the country. So for the next 20 minutes or so, I would like to take you through a little bit of our overall strategy. And I understand that our work on telehealth is of particular interest, so I'm going to spend a little bit more time going in through some of the details of our telehealth work in the past. So let's begin. So the first part is just to give you a brief context of the Canadian environment. As you likely know, Canada is a pretty large country, similar to Brazil in many ways. We've got large geography, but our population density is among the lowest. We've got most people, I think about 80% of Canadians live within 100 kilometers of the US border to the south. And the vast majority of the country is very sparsely populated. The four biggest cities, Toronto, Montreal, Vancouver, and Calgary and Edmonton, that's where the population tends to congregate. I've got a large cultural diversity, especially in my hometown of Toronto, where we've got more than 200 different countries and cultures represented. That's just a little profile of Canada. Moving on to the healthcare system. Next slide. So our healthcare system is a little bit complicated. The main principles of the healthcare system and a large part of the funding comes from the federal government, but the majority of healthcare is delivered at the provincial level. So we've got 13 provinces and territories, and in many ways, each one of them has its own healthcare system. That's not always the most efficient way of delivering care, but that's the way it is right now. So it's a bit of a challenging system to work within those different levels of government. Next, I'm going to talk a little bit about Canada Health Infoway. So my organization was established in 2001. It's an independent, not-for-profit. We have board members that are the deputy ministers of health from every province and territory in the country. We've received and invested about $2.5 billion, and we've worked with each of the provinces and territories to invest that money and to develop the health system infrastructure and promote the growth of digital health across the country. So I will describe some of our work over the years. So our vision is healthier Canadians through innovative digital health solutions. This is an illustration of some of the work that we've already achieved in terms of digitization of our healthcare system. So you can see here things like lab test results. Those are digital diagnostic images in hospitals. That's digital across the country. We've got video conferencing and telehealth, which I'll be speaking about later, in the majority of hospitals across the country. Drug information, so all patients' medications, those are available in most provinces and territories with a couple of exceptions. And we have information around client and provider demographics as well. So this is the initial work, as building the infrastructure for digital health. And I think we're most of the way there in terms of setting up that infrastructure. Next. In terms of use of our electronic health records, we've seen fairly rapid growth in the past 5 years. This chart illustrates healthcare professional use of the electronic health record. So this is the longitudinal record. This is a comprehensive record of patients' labs, diagnostic images, drug information, discharge summaries. So basic information that you would expect to see in a patient's chart. This one tracks the healthcare professionals' use of that information. And like I said, we've seen rapid growth in the past 5 years, but we also experienced pretty slow growth for the first 5 to 7 years. So, it took quite a long time before all these systems were up and running and before these systems started and became part of regular healthcare practice. Next. So this next chart looks at primary care physician use of electronic medical records. So these are the electronic records that you would expect to see in your physician's office. So this is where a physician would keep track of their own patients and all the information that would be in their chart. As you can see, when we started out tracking this in 2004, right up to 2009, there wasn't much movement in terms of adoption of these systems. In 2010, we made an active effort to grow the adoption of these systems across the country to really speed up the adoption of digital health. So we made a significant investment in 2010 to encourage the uptake of electronic medical records by physicians. And you can see since 2010, we've had quite a bit of success in getting those practices digitized. Right now, we're 85% of the way there, which is more or less in line with other leading countries on this point. Next. So this chart is where we track the benefits that have been achieved as a result of use of digital health over the years. And the way we've calculated this is we've done fairly rigorous and detailed studies of each type of digital health investment. So you can see below our infrastructure investments like drug information systems, diagnostic imaging. We did studies of the impact of creating those systems and those repositories, as well as point of care systems. So how clinicians access those systems. So through physician electronic medical records, through ambulatory systems, and through telehome care and telehealth. So putting together all of those benefits, we came up with these figures, which are a combination of benefits to the healthcare system, benefits to clinicians, so efficiencies that clinicians may observe. Let's say radiologists can be more efficient in their work. Also in terms of patient savings, so saving patients time from having to go to repeat appointments or having to travel large distances in order to access care. So doing studies in all of these areas and aggregating them, this is how we've managed to summarize some of those benefits over time. Next. So as I mentioned, I'm going to spend a little bit of time focusing on our telehealth investments. So let's go right into it. Next, please. So what is telehealth? Um, the way we define it here at Canada Health Infoway is really a system that links patients, usually in rural and remote areas, typically in the northern parts of the country, um, with specialists and larger healthcare facilities that are usually in the south, in the more concentrated, populated areas of the country. So the way it would work is patients would visit a nursing station, and in that station, they would have facilities to set up a video conferencing consultation with a specialist who would be in a hospital in Toronto or Montreal or Vancouver. So this system is available in every province, and most hospitals, especially the larger teaching academic hospitals, provide this type of service to residents in those provinces. Next. So I mentioned really the geographical challenges that are addressed by telehealth. So I'm not going to go into more detail on that. Next. This chart really outlines the growth in telehealth use since we began tracking it. So we're doing about close to 1 million telehealth consultations every year. So last year we did about 1 million consultations. So the way we count that is every time that there is a virtual consultation between a patient and a clinician using video conferencing, that counts as one. So we've seen steady growth, although this is using systems that we developed and implemented about 10 years ago. As you're well aware, now with the advent of Skype and personal video conferencing, this technology, while still relevant, especially in those small communities, is starting to be phased out in favor of more personal type of technologies. But nonetheless, it's a very important service, especially for those rural and remote areas. And there are clinical pathways and workflows that have these systems built into them. Next. As we have with our other investments, we've done evaluations on the effectiveness of these technologies. Just in 2017, we've calculated that we've avoided or saved rural Canadians about 245 million kilometers of travel. One of the studies we did, we found out that on average, patients in these areas would have to travel about 500 kilometers in order to access care. So being able to provide those consultations in their local communities saves a lot of travel time and expense. And 245 million kilometers, that's a lot of gasoline, a lot of carbon dioxide emissions that are avoided. Costs for patients are avoided, and also subsidies that our government provides for providing care to those patients, about $269 million in avoided subsidies as a result of the use of telehealth. And next. So part of our telehealth program, there are two main programs within that. So we talked about telehealth as in the video conferencing piece. The other piece we call telehome care or remote patient monitoring. And this is where patients are monitored in their own homes. These are typically patients with chronic conditions like congestive heart failure or COPD. Patients would be enrolled in these programs for about 6 months at a time, and they would input on a daily basis their vital signs. They would submit their blood pressure, their blood sugar levels, and so on. So these things would be transmitted to a command center where a specialized nurse would monitor a group of patients and be able to provide interventions if a patient's condition deteriorates. They could also provide coaching on how patients could manage their care by themselves or with family members. So in a way, it's changing behaviors so that even when they are finished with the active program, they can still continue those healthier behaviors down the road. So if we go to the next page, this chart shows the utilization of telehome care programs across the country since 2010. So we started with about 2,000 patients a year. Now there are about 8,000 patients a year across the country that are taking part in these programs. And as we did with telehealth, next slide, please. We did an evaluation of these programs, and we were able to quantify that since 2010, about 27,000 hospitalizations were avoided, about 46,000 emergency department visits were avoided. And this is calculated through repeated studies that have shown that patients tend to reduce their hospitalizations and emergency visits by about 40 to 60% by taking part in these programs. So they're highly successful. And when we ask patients how they felt about these programs, the numbers are extremely high. Like, patients are very satisfied with these programs and their participation, as you can see by some of the results from surveys that we've administered through a variety of programs. Next slide. So this chart again shows the growth in benefits from telehealth and telehome care over the years. They're split between costs avoided for patients and costs avoided to the healthcare system. So through reduced hospitalization, reduced utilization of emergency rooms, we can calculate the costs avoided. And this is largely driven by that increase in the utilization. So we had 2,000 patients when we started, and now we have about 8,000 patients in these programs. Next. Throughout the different projects that we've evaluated and different programs for telehealth and telehome care, we identified a number of critical success factors that differentiated the more successful programs from the ones that did not succeed as well. But some of the key things to keep in mind, things like clinician reimbursement. So what kind of incentives do clinicians have for using these types of programs versus regular care? Professional development, training, implementation of technology. So how this technology is implemented, is it integrated into clinician workflow? Licensure, other regulatory issues. Can physicians in one part of the country provide care to patients in another? Are there any barriers to that care? Overall governance and policy, which is important for most things, most projects of this type. Change management and adoption, tracking utilization over time, benefits realization and measurement, which is the area that I work in. So tracking use of these systems and the benefits that are generated, and communicating those benefits to potential users so that they're more likely to adopt. And a big one is funding for implementation and transition to the mainstream. So doing small projects, showing success, but then supporting the growth of those small pilots and small projects into broad, large-scale development. So making sure that there are funds available for that kind of transition. So where are we now? I'm just going to talk a little bit about where Canada Health Infoway is now. What are some of the big areas of focus for the next few years? So in terms of where we are, we've compared ourselves to countries in the Commonwealth Fund, which are really countries that are essentially our peers in terms of the way healthcare is delivered, that we would expect to be comparable to these countries. We're not doing so great in terms of comparisons to those countries, and I'll show you on the next slide what those countries are. But there are some areas where Canada lags. Timely access to physicians and services, so waiting to see specialists and so on, that's been an issue. Over-reliance on providing care in hospitals and care by physicians, which is the most expensive way of delivering care. Also, we rank lowest in access to health information for patients. So you as a regular Canadian, having access to your own lab information, to being able to email your physician, this is still pretty rare for most Canadians, and other countries have the lead when it comes to providing these types of services. Also, there's lack of coordination across provinces and territories and the independent health systems. This is largely because really they operate like individual countries. There's not much collaboration between them when it comes to health system delivery. EHR infrastructure is siloed. So again, we have repositories that were built in each province, and there's not much communication between them. And the pace of change is quite slow, but hopefully accelerating. So we've done some comparisons, like I said, to other countries. As you can see here, when compared to places like France, United States, Scandinavian countries, the UK, Australia, Canada ranks pretty low when it comes to access to information and communication, virtual communication with physicians. So this slide is showing the evolution of our strategy. We've spent 2001 to about 2010, 2012 on building the infrastructure, putting systems in place that can support digital health. Then we spent the next phase on providing clinician tools. So putting in point of care systems that can access these large repositories of data. So electronic medical records, hospital information systems, all linked together. The next phase, which is what we're starting now, and we've started for a while, but really getting underway in the next few years, is providing access to Canadians. So trying to bring up that lagging piece where our own citizens don't have direct access to their health information. So that's going to be a focus over the next couple of years. Next slide. And it's going to take form. We have two major initiatives underway right now. The first one is Access Health, and really that aims to address that gap in access to information. The second initiative, which is already underway, is our Prescribe It initiative. It's a national electronic prescribing service, which allows physicians and nurse practitioners, prescribers, to send prescriptions electronically directly to a patient's pharmacy of choice. It eliminates the need for paper prescriptions. So those are our two main initiatives. Next slide. So in summary, we've got a big country, vast geography, sparsely populated in many places. We moved from investments in digital health infrastructure to now providing access to different groups, Canadians overall, clinicians, to that information. We rank lowest amongst peers in access to health information, so that's a key area of focus, trying to narrow that gap. And we're doing it because we know Canadians want that access and have a lot of interest in accessing their health information online. So next slide. That ends my presentation, but I believe we have time for any questions that you may have. So thank you.